I decided to do this project, this video report on ovarian cancer because it runs in my family. And my grandma died when I was 8 years old of ovarian cancer, and it runs along the female line. My cousin died when she was 9 of brain cancer, and I've had many great aunts and great grandmothers who have died of pelvic cancer, throat cancer, breast cancer, and my aunt was just recently diagnosed with thyroid cancer. But the thing about cancer in my family is we don't really know much about it. A lot of the research and discoveries that have been made in the area are very recent, and I noticed in talking to the older generations that they are even afraid to get genetic testing done because they don't really see the point. They don't see how any good could come of it. But I chose to do this project specifically on ovarian cancer because I saw a trend of mostly cancers in the pelvis area in my family, and because of my grandma, I decided that it'd be more relevant to do that. My grandma was diagnosed with ovarian cancer stage 3C, and they gave her 3 weeks to 3 months to live, depending on how her surgery to remove her ovaries went. And after that, she had chemo. Depending on how the chemo went, they gave her 3 months to 3 years, and she lived for 5 years. Talking to relatives, I found out that 6 months before she was diagnosed with cancer that they told her had been in her body for a year, she'd had a pap smear that the results were good on, that she was told that there was nothing wrong with her. And so I found all that really confusing, and so I took this opportunity to do some research and to share that research with you because I think that something this important and life-changing should be available to all of us. Ovarian cancer is a cancer that forms in tissues of the ovary, one of a pair of female reproductive glands in which the ova or eggs are formed. Most ovarian cancers are either ovarian epithelial carcinomas, cancer that begins in the cells on the surface of the ovary, or malignant germ cell tumors, cancer that begins in egg cells. Ovarian cancer is the deadliest female reproductive cancer. And unlike most cancers, its mortality rate has not decreased since the war on cancer was declared. There are 3 different kinds of tumors associated with ovarian cancer: epithelial, germ cell carcinoma, and stromal carcinoma. Epithelial tumors are tumors that develop on the thin layer of tissue that covers the ovaries. They are the most common and usually occur in postmenopausal women. Germ cell carcinoma tumors are tumors that develop in the cells that form eggs and are most often found in women in their early 20s. Stromal carcinoma tumors develop in the connective tissue cells that hold the ovary together and the cells that produce the hormones estrogen and progesterone. The exact cause of ovarian cancer is not yet known. However, we do know that some things that can increase the risk of developing the cancer. It is thought that genetic errors may occur because of damage from the normal monthly release of an egg or increased hormonal levels before and during ovulation. Risk for developing ovarian cancer is highest for a woman in her 60s and increases with age. Risk can also be higher if a woman has used menopausal hormone therapy. Other reasons a woman's risk of developing ovarian cancer would be higher include if she started menstruating before 12 years old, she has not given birth to any children, she had her first child after 30, she experienced menopause after 50, she has never taken oral contraceptives, and she has suffered from obesity. The following symptoms are seen in women who have ovarian cancer but are also common in women who do not have cancer. Abnormal menstrual cycles, digestive symptoms such as constipation, increased gas, indigestion, lack of appetite, and or nausea and vomiting. A sense of pelvic heaviness, swollen abdomen or belly, unexplained back pain that worsens over time, vaginal bleeding, vague lower abdominal discomfort, weight gain or loss, and other symptoms that can occur with this disease are excessive hair growth, increased urinary frequency or urgency, and you should see your doctor if you have any of the following symptoms on a daily basis for more than a couple weeks. Bloating, difficulty eating or feeling full quickly, or pelvic or abdominal pain. One of the main problems with detecting ovarian cancer is that a lot of the symptoms of this disease can also occur if the disease is not present. And so it's hard for health professionals to detect or tell when ovarian cancer is developing. Like most cancers, ovarian cancer progresses in stages, and each stage has 3 substages. In stage 1, the cancer is limited to one or both ovaries. In stage 1A, the cancer is limited to the inside of one ovary, and the surface of the tumor has not ruptured. In stage 1B, the cancer is limited to both ovaries. There are no tumors on the outer surface, and the surface of the tumor has not ruptured. In stage 1C, the tumor is classified as either stage 1A or stage 1B, and there is a tumor on the outer surface of one or both ovaries and at least one ruptured tumor. In stage 2, the tumor involves one or both ovaries and extends to other pelvic structures. In stage 2A, the cancer has extended to and involves the uterus and possibly the fallopian tubes. In stage 2B, the cancer has extended to the bladder or rectum. In stage 2C, the tumor is classified as either 2A or 2B, and there is a tumor on the outer surface of the ovaries, and/or there is at least one ruptured tumor, and/or there are malignant cells present. In stage 3, the tumor involves one or both ovaries, and the cancer has spread beyond the pelvis to the lining of the abdomen, and/or the cancer has spread to the lymph nodes. In stage 3A, the cancer is in one or both ovaries, and there are microscopic deposits of cancer in the abdomen. In stage 3B, the tumor is in one or both ovaries, and there are deposits of cancer in the abdomen no larger than 2 centimeters, and the cancer has not spread to the lymph nodes. In stage 3C, the tumor is visible on both ovaries, and the cancer has spread to lymph nodes, and/or the deposits exceed 2 centimeters in length. In stage 4, the cancer involves one or both ovaries, and distant metastases to the liver or lungs have occurred. There is not yet a prevention method or treatment for ovarian cancer. However, a healthcare professional can help identify ways to reduce the risk of this cancer and decide if consultation with a genetic counselor would be appropriate. Thank you for watching my video. I hope you enjoyed it, didn't fall asleep. If you would like to learn more about ovarian cancer, or you're looking for a support group, I found a wonderful website. It's www.ovariancancer.org. It's OVARIAN cancer.org. They have wonderful resources. Thank you.